Okay, so I'm going to be doing the Glascow Coma scale, which is going to assess the patient's level of consciousness. So first, we're going to assess for an eye response. So before I enter the patient's room, it is important to look for a spontaneous eye response just when I enter the room first, to differentiate between an eye response to spontaneous stimuli or to a verbal response. So first, I'm going to look for that spontaneous eye opening, and then after that, I will announce myself and look for eye response to a verbal sound. Hi, Erin, how are you today? Hi, Erin, I'm your student physical therapist. I'm gonna be working with you today. Can you open your eyes for me? So with that one, there is no response to a soft or a loud voice. So next I would insert or do a peripheral fingertip stimulus and check for an eye-opening response. Hi, how are you?
Oh.
Okay, so the patient did open their eyes to the fingertip response, so that would be a 2. A 4 would be if they open their eyes to the spontaneous stimuli. A 3 would be if they open their eyes in response to a verbal sound. And then a 1 would be if the patient did not open their eyes to any sort of interference or any stimuli. So now I'm going to assess for a verbal response. Hi, can you tell me your name?
People.
Do you know where you are?
When they're they.
Do you know what day it is, what month it is?
And in there.
Okay, so for this, a 5 for the verbal response would be if the patient was oriented and could tell me their name, where they are, what day it is, or what month it is. A 4 would be if the patient could speak clear sentences but was not oriented to where they were. So this patient would score 3 because they had single words and they were a little unoriented. A 2 would be if the patient can't speak and just gave a moan or a groan, and then a 1 would be no verbal response. So now I'm going to be assessing a motor response for the patient. So first, what I'm going to do is ask the patient to do a 2-step command. So Erin, can you go ahead and grab my hand, squeeze it, and let go? Okay, so the patient is unable to complete that. Next, I would apply a central pressure right on the upper trap, increasing the intensity. There is no response for that one. I'd apply pressure to the supraorbital. There is no response. So from there, if the patient were to complete the 2-step command, that would be a 6. If the patient could elicit a flexion response above the level of the clavicle for the pressure on the upper trap, that would be a 5, or the supraorbital notch. If the patient were to go below the level of the clavicle, I would then apply a peripheral stimuli. Okay, so for that extension response, we would grade the patient as a 2. If they were to elicit that normal flexion response away from the body, that would be a 4. If they did a abnormal flexion response towards the body, that would be a 3. So this patient is a 2 because they elicited an extension response, and a 1 would be if the patient was unable to provoke any sort of motor response.